And again, you have 3 minutes. And please, if it would be very helpful, we have 4 more speakers after you. If you can bring up points that other speakers have not raised.
Thank you so much for allowing me to speak. I actually made sure this is less than 3 minutes. My name is Paul Lee. I completed my residency and fellowship at New York Eye and Ear in 2004. I'm the president of the New York Eye and Ear Infirmary Alumni Association, which includes all residents and fellows who've trained there. The Alumni Association strongly opposes this application. I'm also the associate program director of the ophthalmology residency program. I've won various teaching awards in my career and was promoted to associate professor at Mount Sinai a few years ago. And the residents and fellows oppose this. We've already had meetings with leadership here where they've told the residents that all their cases now have to be done at Beth Israel, that we can no longer operate at New York Eye and Ear. So even though he's saying he's not going to reduce services, he's already starting to tell us that we have to leave. And in the application, if you can refer to the figure where it has New York Eye and Ear visits by service, as Ms. Otley pointed out, the inpatient numbers are going up. But if you can look at the number of outpatient visits in ambulatory surgery ambulatory surgeries performed at New York Eye and Ear, they have drastically gone down. So please look at the numbers in this application. They try to tuck it in there and hide it. But Mount Sinai has been drastically reducing services at New York Eye and Ear over the past 2 years, and numbers show it here. We've had 25,000 surgeries done in 2017. We're down to 16,000 surgeries. We had 130,000 outpatient visits. We're down to 85,000. So they've actively been reducing services. Jeremy Bull told me in his office, because I extended his hand to him as the Alumni Association president, that he wants to sell the property. So please do not be deceived by this ploy that we're going to merge certificates and we're trying to save the hospital. Again, the numbers do not lie. 2017 inpatient visits were 273. The inpatient, as Ms. Otley pointed out, is up to 256. A couple other numbers that I want to point out. If you look at the net assets of Beth Israel, what are the net assets of Beth Israel? 17 million. What are the net assets of New York Eye and Ear? 139 million. How is an institution that has $17 million in net assets supposed to take over an institution that has $139 million? It's very easy. It's because of the real estate evaluation. The other thing is the application states that the deficit in 3 years is going to be 139 million, but that they got a letter from the Mount Sinai CFO.
You have 30 seconds.
Okay. The plan is support the losses. It's 3 words, support the losses. No one supports this plan. None of the faculty do. The faculty are in the dark. The residents don't. The patients don't. The local elected officials don't. You know who wants this plan? The Mount Sinai Board of Trustees. Those are the only people who want this plan to go through, because by taking away the certificate, they're going to be able to move pieces around and eventually sell it as they wish. The only people who want this is the Board of Trustees at Mount Sinai. So please do not approve this, because this is their first step in moving pieces around.
Thank you. Let's see, next is Heidi Sedgwick or Sedgwick.
Hi.
Thank you. You have 3 minutes.
I'm Heidi Siegfried. I'm the Health Policy Director at Center for Independence of the Disabled in New York. And we are a cross-disability organization. We serve people with all types of disabilities. So that would be including the deaf and hard of hearing and the blind and low vision. So our mission is to make sure that people have the services they need to live independently in the community and not in nursing facilities, psychiatric facility, any type of institution. And as we know, we had 15,000 people die in nursing facilities, and it would be really nice if this body would care about those people as much as 2 babies. I will say that we are also concerned about the lack of transparency and moving services from a mission-driven hospital to a for-profit hospital. People with disabilities have found that market-based healthcare delivery, which privileges profits, has reduced access to care and has resulted in more denials of care. We used to have our office at 841 Broadway in Union Square, and so we serve a lot of deaf people in particular, because we have American Sign Language and deaf employees. And, you know, people have been going there for hearing aids, ear infections, whatever. And we don't know where they are going to be going. And we expect that they're going to have difficulty in keeping their services in place, as Harvey had referenced. So we think that there really needs to be more community engagement. It needs to be occurring before we're making these kinds of disruptions in delivery systems. We support the proposal of Community Board 3 to approach the borough president to convene a multi-stakeholder process. Stakeholders, of course, should include representatives of the deaf and hard of hearing community and the blind and low vision community. Sydney was involved in the process that Gail Brewer attempted to convene many years ago on the previous radical downsizings of Mount Sinai. And we also are members of Community Voices for Health Systems Accountability. So we also joined in their letter that everybody has received. Thank you.
Thank you. Next is Michael J-A-S-C-Z.
The C is silent.
The C, okay. Jazz.
Yeah.
You have 3 minutes.
I'm a kid from Lancaster, Pennsylvania, who, when my parents brought me here, I was very excited to get to the top of the world, a place I called the Umpire State Building. And I became a tour guide. I know this doesn't have to do much with the hospital right now on this issue,
It's a good
but
story.
I have a nonprofit called the Relationship Foundation, and we're explaining to the schools around the city about trauma and how to mitigate it because of all the conditions that go on in our society. And my retina detached several years ago, and Dr. Ronald Gentili, repaired my retina. I happen to live close by. I'm on 10th between A and B. And if I had, and I've since then had to, the retina has torn again, so I was able to continue to go there on a regular basis. And now my cornea got scratched. So I have a cornea replacement. You probably can't tell, but the cornea failed. I have to have a place that I can go to if I have to travel around. Now, before I went on Social Security, I sat in the clinic on a regular basis, and I was a bit out of place because most of the people there were minority people. And I think the key point is people who have certain disabilities, especially things like people who are in wheelchairs. If you got to wheel somebody around this city for multiple services that the Ioneer provides, it's going to be to the detriment, and especially to the minority community. But everybody in Manhattan knows where this place is, and if they have to start traveling from one place to another, I might have lost my eyesight. If I had to go, if I couldn't be, I went in as an emergency. If I was in the wrong location and said, well, you got to go over to 8th Avenue or wherever another part was there, I might have lost my eyesight. And I think the point about there should be more community input. This building provides services that are well known. People know where to go. And nothing is more important than keeping your eyesight, as my mother used to say. Take care of your eyes. And I do urge everyone to put this off until there's more community input. Thank you.
Thank you very much. Our last speaker who is signed up is Faith Daniel.
Good afternoon, committee members. My name is Faith Daniel, and I was born and raised in New York City and received my MPA from Columbia's Middleman School of Public Health. I am a co-facilitator for Community Voices for Health System Accountability, short for CVHSA. It's a statewide network of healthcare advocates who collectively focus on ensuring that New York State's oversight of health facilities considers community concerns about proposed transactions and the likely impact of health equity. As a child, I would accompany my grandmother who suffered from cataracts from our home in the Bronx to the New York Eye and Ear Infirmary when she needed eye procedures done. This facility remains as an important source of specialty care for so many across New York City and the surrounding areas. We at CVHSA are particularly concerned with the proposed merger of New York Eye and Ear Infirmary into Mount Sinai's Beth Israel Medical Center, as a Crain's New York business article revealed that in last July 2022, there is a well-developed plan to disperse services offered at New York Eye and Ear Infirmary to several different locations across Manhattan, as many folks have noted. According to the article, surgeries now performed in the facility would be transferred to operating rooms at Beth Israel and a new ambulatory surgery in the Flatiron District. But those plans are not outlined in the CON application before seeking approval to merge New York Eye and Ear into Beth Israel. Instead, the application and the New York State DOH summary of it both state that there will be no change in the availability of services as a result of the merger. We noted that a separate CON that appears later on in your agenda today appears to be the first step in carrying out some of the relocation of services mentioned in that Crain's New York article. If the success of this merger plan actually will rely on reducing costs and monetizing assets, as the New York State DOH summary suggests, these actions could result in the elimination, reduction, or relocation of services that are relied upon by many patients within one integrated setting. These patients are unique and include many people with significant visual and hearing impairments, as my colleague Heidi noted, from whom navigating change delivery systems and disconnected services can be quite challenging, such as relocations could create inequities in accessing care.
You have 30 seconds.
We urge you to insist on having the full picture of what Mount Sinai plans to do with the New York Eye and Ear facility before you vote on the merger application. Moreover, we request that you direct Mount Sinai to fully engage the affected patients and the community where New York Eye and Ear is located. Thank you so much.
Thank you very much.